two parts, the upper half and the lower half. And I told you that upper half is going to receive its blood supply from the superior rectal artery. You can see the superior rectal artery coming down over here, which is basically the continuation of the inferior mesenteric artery. And when it will reach at the posterior surface of the rectum, it is going to divide into the right and the left branches. And about in the mid of the rectum, it is going to divide into the multiple small branches, right? And from here, it is going to pierce this muscular port, and then it will run between the muscular wall and the mucosal wall, right? दोनों के दरमियान run करेगी, and it is going to supply up to the upper half of the anal canal, right? It is going to make the loops, and by these loops, it is going to make this supply the upper half of the anal canal. Whereas the lower half, it is supplied by the, you can see, the inferior rectal artery, which is the branch of the internal pudendal. This is the internal pudendal artery, and is going to give this branch, that is a inferior rectal artery, which is going to supply the lower half of the anal canal, right? Okay, Ji. As far as the venous drainage is concerned, as I told you before, that around the rectum here, the superior rectal artery, middle rectal artery, and the inferior rectal artery, these are going to make an anastomosis, right? So that anastomosis, these are also followed by the accompanying veins, right? So these veins in this lower part of the rectum or the in the anal canal, they are going to make the two type of the plexuses: the internal rectal plexus and the external rectal plexus. Here you can see the internal rectal plexus and the external rectal plexus. Okay, so the upper half may, again, which is contributed by the superior rectal veins, right? And then, of course, these plexuses are contributed by the veins for which are accompanying the superior rectal, middle rectal, and inferior rectal arteries, right? So, so in the upper half over here, this is the plexus form, which is form that is called the internal venous plexus, or the here, which is rectal plexus, which is just going to continue downwards over here in the anal canal in this region, and then the inferior rectal plexus or the external rectal plexus. ठीक है जी, ये प्रॉब्लम तो नहीं है बच्चे, ठीक है? And these plexuses, they are going to drain along with their respective arteries के साथ, like the superior rectal veins, and they will be going towards the inferior mesenteric vein, the middle rectal veins. These must be going towards the, कौन सी आर्टरी से आती जी, किसी को याद है? Middle rectal artery is a branch of the internal iliac artery, right? So यहाँ से जो blood they will flow towards the internal internal iliac vein, and the lower part is going to drain into the inferior rectal vein. Inferior rectal veins, it is going towards the internal pudendal vein, right? So, well, the important thing is that these two, these three sort of veins, these are going to make the anastomosis in the lower part of the rectum and the upper half of the anal canal over here. They are going to form the internal venous plexus, and the other one is over here, that is the external venous plexus, right? Okay, now the lymphatic drainage. Lymphatic drainage, I have told you before. Okay, nerve supply. Nerve supply, nerve supply, maybe we have got the upper half, and I told you before that it is going to receive its, you see, nerve supply, which is autonomic, and that's coming from the inferior mesenteric plexus. Or inferior mesenteric plexus में जो आपके parasympathetic fibers आ रहे हैं, वो कहाँ से आ रहे हैं जी? किसी को याद है जी? Parasympathetic fibers are coming from the S234, the pelvic splanchnic nerves, right? And and as told you before, that is receiving its autonomic nerve supply through the hypogastric plexuses. Then what? Then it is sensitive to stretch, right? Whereas the lower half, I told you before, that is sensitive to pain, and it is going to receive its somatic innervation by the inferior rectal nerve, which is a branch of the pudendal nerve, right? Ji? Problem to nahi? Okay. Now, okay. Now the internal sphincter jo hai, so internal sphincter, it is involuntary, right? So it's receiving its nerve supply from the inferior epigastric plexus, whereas the external sphincter, it is voluntary, so it is going to receive its nerve supply from the inferior rectum. ठीक है जी, कोई problem तो नहीं है जी? Okay. Whereas as far as the lymphatic drainage is concerned, so told you before that the lymphatics will travel upper after lymphatics कहाँ जाएंगे जी? ब्लड सप्लाई कहाँ से आ रही थी पर आपकी?
superior rectal artery.
स्पीड मेसेंटेरिक आर्टरी से आ रही थी. अपर आप कहाँ से? इंफीरियर मेसेंटेरिक से आती है, स्पीड मेसेंटेरिक से आ रही थी.
inferior.
Inferior mesenteric artery through the, you know, the superior rectal artery, right? The superior rectal artery, so the pararectal lymph nodes, they are going to drain into the inferior mesenteric lymph nodes. ठीक है? और lower half की जो है, that is running along the, you know, towards the medial group of the superficial lymphatic, right? ठीक है जी? So lymphatic drainage of the lower half of the canal is going towards the medial group of the inguinal, superficial inguinal lymph nodes. Okay, there are certain clinical features. There are clinical things, we just need to talk about it now. The most common problems that patients come to you, that is the patient comes to you with, you know, complaints of the anal fissures. What is the anal fissure? It is basically a small tear in the posterior part of the midline of the anal canal. ठीक है? ये small tears होते हैं जी. And you see normally the patient will come with this complaint जी, when we are going to pass a stool to the fresh blood case, it is mixed with the, you know, blood, fresh blood, right, or the drops of the blood, and he must be having a complaint of the, you know, regular constipation or passing the hard stools. So due to passing the hard stools and the constipation, when he tries to forcefully expel it out, that solid, you know, hard stools, they are going to damage this mucosal lining. And normally this, you know, small tear in the anal mucosa, it appears in the midline in the posterior part of the anal canal. Right? So anal fissures is one of the complaint. That is what anal fissure, you can define it. That is a slit-like lesions, right? Or the small tear in the anal mucosa. Okay. इसके अलावा there can be certain perianal abscesses. ठीक है, कोई abscess बन सकती है, inflammation हो सकती है, that can lead to, you know, the collection of pus in that region. And if that pus is going to, you know, drain by itself to the perianal skin and making its pathway, you see, any inflammation here, infection of the, you know, anal column, basically, the anal column की कोई infection अगर होती है, so pus will track its way down to the, you know, it comes out on the, you know, perianal skin. You see, this is the anal canal. Pus यहाँ से आने की बजाय is going to make its pathway, and you see, eroding the, you know, this area and sphincter, and it's going to open by another opening in the skin. So this abnormal passage, right? This small tunnel that developed between the bowel, or, you know, anal canal and the, you know, the perianal skin over it, skin near the anus, right? This tunnel, this abnormal passage, that is called as an anal fistula. It's also called as a fistula in anal, right? So when you see, whenever there is a pus over there, it is going to make its path to drain it out. It is going to drain just close to the anal opening, just to the nearby skin, and is making another passage that is called as a anal fistula. Is it clear, जी? Okay, problem तो नहीं है, ठीक है? This is also the common cause. The patient will come to you with the complaint जी कि I have the, you know, around the anal canal, I have got the opening or area, and there is a pus coming out of it. And then when you're going to perform the, you know, PR examination, and you examine it carefully, then you can find that there is a fistula. That is this called the fistula in ano, or the anal fistula. ठीक है जी, कोई प्रॉब्लम तो नहीं है बच्चे? Okay. Other than this one, there is one more complaint, which is a common complaint over here in this region. The patient comes to you, that is the hemorrhoids. नाम सुना भाई hemorrhoids का आप लोगों ने? जी, have you heard about the hemorrhoids?
Yes, sir.
So hemorrhoids basically क्या होते हैं? The hemorrhoids are basically the swollen or the dilated veins. और ये veins कहाँ पे बनी हुई, मैंने आपको बताया था कि आपके दो venous plexus बनते हैं. The internal venous plexus है होती, external venous plexus. ऐसा ही है ना जी? So these swollen dilated veins, right? These are which are, you know, formed. These are named as the hemorrhoids. ठीक है, जब ये veins dilated हो जाती हैं, swollen हो जाती हैं, right, due to different causes, so that these are called as the hemorrhoids. So ये hemorrhoids, these are two types: the internal hemorrhoids and the external hemorrhoids. तो बेटे जो इंटरनल हेमराइड्स हैं, these are basically ये आपकी जो एनल फोल्ड्स हैं, यहाँ पे जो आपकी ये इंटरनल वेनस प्लेक्सस बनते हैं, the veins in this region they will become dilated. जब ये डायलेट होते हैं तो the walls, जो म्यूकोजल सरफेस है ना, जी म्यूकोजल का जो इंटरनल स्ट्रक्चर है, तो वो क्या है, दैट इज द म्यूकोजल लाइनिंग है, उसके बाद ये करता है मस्कुलराइज म्यूकोजी है, एंड द मस्कुलराइज म्यूकोजी के साथ आपकी ये मस्कुलर सॉरी जो म्यूकोजल मेम्ब्रेन है, इट इज अ बिट एडहेरेंट ड्यू टू द डैमेज टू द मस्कुलराइज म्यूकोजी, तो आपकी ये जो म्यूकस मेम्ब्रेन है, इट इज गोइंग टू हैंग डाउन, ठीक है, जब हैंग डाउन हो जाएगी एंड द वेन्स बिकम swollen, then these are just going to prolapse with the anal opening. The patient comes to you with the complaint, Kiji, when I'm going to pass the stool, or when I am going to defecate, so some things, some soft tissue that comes out of my anal canal, and when I just feel it, then it is, dribbling with the blood. Okay, fresh red blood are out there, but it's not much painful. Okay, I can just push that thing inside again, right? To feel relief. जैसे ये मतलब it will come out, so discomfort feel होता है, right? And this is bleeding, then he just going to push it inside by his finger, right? So he said, there's something comes out of it. So it means that that is the internal hemorrhoid. The mucous membrane of the upper half of the anal canal, or these it is going to prolapse downwards and come out of the anal canal, right? And this is not permanent; it can be pushed backwards. ठीक है जी. So this is and usually normally these are the painless internal hemorrhoids, but there is a bleeding. ठीक है जी. So these are the internal hemorrhoids. What about the external hemorrhoids? And these is the internal hemorrhoids. These are coming from the internal venous plexus, internal rectal venous plexus से आ रहे हैं. Whereas the external hemorrhoids, these are coming from the external venous plexus, and these vessels in this region of the external hemorrhoids. So these are basically, they appear swollen and thrombosed all around. You can feel the swelling around the anal canal. Okay? You cannot push it back inside like in the case of the internal hemorrhoids. Okay, na? So patient comes to you with the complaints of itching and then the swelling around the anal canal, right? And of course, the bleeding and pain is there. These are painful. So another difference, the internal hemorrhoids, these are not much, painful, but when you painful क्यों होंगे? These are present where in the somatic area, ठीक है? Ectodermal region में है ना, तो यहाँ पे जो nerve supply कर रही है वो inferior rectal nerve supply कर रही है, और यहाँ पे जो nerve supply कर रही है, this is the autonomic nerves. These are give the feeling of discomfort due to the stretch, ठीक है? Whereas the external hemorrhoids, these are quite painful, right? And these appear as a swelling around the anal canal, ठीक है? Constant होते हैं. So causes की क्या है जी? Hemorrhoids की pregnancy में develop कर जाते हैं. The patients with the long history of the constipation, ठीक है ना, chronic constipation के जो cases होते हैं जी, whenever they are going to pass out or defecate, so they have to push the stool out of it, and due to such kind of thing. And ऐसे लोग which are the prolonged toilet sitting करते हैं and straining, right? Okay, so these are the और treatment क्या होगी जी इसकी? Hemorrhoids की जो treatment है ना बेटे, it consists of the we ask the patient to take the fiber diet, right? And we have asked them for the sitz bath. Sitz bath is usually to take the lukewarm water and put some medicine in it, and or other than that medicine also, we just ask them to sit in it, right? And then the topical treatments are there. ठीक है ना, जो painful हैं तो we are just going to give them the hemorrhoidal creams, जो कि local anesthesia, local anesthetic होते हैं, because they are just especially for the external hemorrhoids, ठीक है ना, so that they cannot feel much pain. Then they have to sit on the cushions, right? And then there are surgical options that we are going to remove these clots in these blood vessels, right? Or the injections are there. We just put the injection, and we can bond these hemorrhoids. ठीक है जी. Then another procedure, there is hemorrhoidectomy, right? Surgical option, we are just going to remove them. ठीक है. And nowadays latest technique which we are going to use, that is a stapled hemorrhoidectomy, right? So these are the different multiple options, the surgical options, right? in the cases in which they're much more bleeding and the hemorrhoids are much more developed. Right, Ji? So we have got we have finished with the anal canal. Any problem till